Good morning, everyone. Welcome to Groundwork Ohio's third morning meeting. Very excited to see everyone here. Just a couple housekeeping notes. The chat is open since it's a meeting format, so please feel free to add questions in there, and our team will do our best to find anything time sensitive, but we'll reserve 5 minutes at the end for questions. I don't want to wait any longer to introduce. We have a wonderful guest today. Joel Potts is the Chief Government and External Affairs Officer at Ohio Department of Children and Youth, where he brings over 35 years of experience with state government. This is a key leadership role at the state agency who's dedicated to promoting positive lifelong outcomes for Ohio's youth through programs like early intervention, through quality education, and family supports. Most recently, Joel was also the executive director at the Ohio Job and Family Services Directors Association, which represents the 88 county departments of job and family services around the state that administer one of the largest health, human service, and workforce systems in the nation. And prior to that work, he worked for 15 years with ODJFS. During his tenure with the state, Joel was responsible for managing the development and implementation of Ohio's welfare reform program. And just on a personal note, Groundwork Ohio is so grateful for his partnership and leadership, and we love seeing him all over the state working to do everything he can to spread the good word about the ways that we can best improve Ohio children's lives. So I don't want to take up any more time because he has a really great presentation, and just would love to welcome you here today, Joel.
Oh, thank you. Good morning, Brittany. Good morning, everybody. And thank you for including me. I'm happy to have the conversation and talk about the new Department of Children and Youth. You know, to me, I've been here a year, but for everybody else, it's still, I know, pretty new, and lots of changes and a lot of things are taking place. So I appreciate you giving me the opportunity, and also really appreciate all the work that you're doing. I know Groundwork just celebrated their 20th anniversary of advocating for kids, and I think it's very interesting to read, you know, your mission and vision and goals line up very well with what the governor is hoping with the Department of Children and Youth. So thank you for allowing me to have the opportunity, but thank you for all your advocacy work on behalf of the kids. It's always great working with you and working with your team. So I'm going to go through several slides this morning. There's a lot of numbers in it. I'll go through them quickly, but I know, Brittany, you'll be sharing the information and sharing the presentation with folks so they could always go back on it. And at the end, I'll have my contact information as well. But there are a few things that we want to go through. So first of all is just the Department of Children and Youth. Do what's right for kids. Every time you hear Director Wente speak, every time we talk, when we look at things, that is the driving question that we use in everything we do. How does it affect kids? Does it help make things better? You know, the governor wanted an agency that was focused, that the people wake up every day looking out for the best interest of children and focused on promoting positive lifelong outcomes for kids. And that's what we are doing here at the Department of Children and Youth. So a couple things that are really significant to us, that really keep us thinking, and I think helps generate a lot of the conversations about what we're doing, and important things to understand of why we're focusing in these particular areas. But on average, there are 194 child abuse and neglect reports screened in each day in the state of Ohio. That's about 1 out of every 7 minutes. Now, those are the ones that are screened in. We receive more reports than that. Those are the ones that we receive through our local agencies, through the local public children's service agencies, that tell them there's at least enough evidence that they need to further the investigation and look more into that case. From the time that folks leave for work in the morning, get home at night, on average, 1 child under the age of 1 in Ohio will have died. That's roughly 1 out of every 9.6 hours. 13% of children under the age of 6 are living with families in which someone has had to quit, change, or refuse a job because of problems with childcare. And nearly 1 out of every 5 children in Ohio is experiencing poverty at any point in time, which is roughly $30,000 a year for a family of 4. And one thing I really do want to stress with the Department of Children and Youth, we look at programs impacting all children, all ages, and all income sources. So we're not, poverty obviously has a huge impact on kids. We are not limited just to poverty programs. So the who, what, why, who we are. As I said, the governor created DCY for the purpose of reducing duplicative programs from across state governments, increasing administrative efficiencies, and improving the delivery of services to families. So we have programs that have come from 5 different state agencies. And again, I want to stress, these agencies still continue to exist. There were programs from within those agencies have been brought together. where it's believed that these programs can help complement and not compete with each other and provide resources and services that are going to help get us better outcomes. So departments include Department of Mental Health and Addiction Services, Department of Developmental Disabilities, the Department of Health, the Department of Job and Family Services, and Department of Education and Workforce. Programs from those 5 different agencies have been brought over. It's not to say that those things weren't going well, not to say they weren't doing well. In fact, these programs, many of them have been doing extremely well, but the belief is that while they're doing well separately, we can do much better collectively in providing resources and services to kids. So our vision and mission. To be honest with you, these things, everybody has a vision statement, everybody has a mission statement, but unless you have a plan behind it, it really doesn't mean much more than the paper is written on. To us, this is not just something we say, it's something that we do every single day, that we want to make sure that each Ohioan is able to live up to their full potential, promote positive lifelong outcomes for all youth. Our goals are to help more children thrive in safe, healthy environments to reach their first birthday and beyond. I really want to focus on infant and maternal health. When we look at the programs, I had already mentioned that roughly one or every 9.5 hours, a child dies in Ohio. The majority of those cases, the death was preventable. We know that 57% of those kids, their families were on Medicaid, and many others also had health care, not necessarily through the state system. But there's a big difference between having a medical card and having medical care. And I think in a lot of cases, those are areas that we really want to address, is making sure that people have access to the right kind of care. When they go to the emergency room, often, the emergency room may not have people who are equipped to handle, infant crisis and those sorts of things. So how do we work better with those institutions to make sure we have better care? We want to support families with needed resources proactively. People generally come to the health and human service world in crisis. They're not waiting around for a beautiful day like today and saying, just for the heck of it, I want to go check it out and see what's going on. Something has brought them, to our agencies and our program doors. And the one thing that I have experienced for over 30 years, I think it is the most difficult things for people to understand when it comes to health and human services in this state and in this country, is that while we provide billions of dollars in services to families and individuals throughout the state, almost all of those are eligibility-based, not need-based. So no matter how great the need is, sometimes it's difficult to get the person those specific resources because we have to go through the eligibility systems. Somebody can come to us and say, as an example, I don't know what I'm going to do. I just lost my job. I don't know how I'm going to feed my family. We can sit them down. We could help them make their application, and we go through. We have to verify those eligibility factors. And at some point, maybe a day, maybe a week, maybe a couple weeks later, they get notified and said, hey, great news. We found that you are as desperate as you said you were, and here, we can help you get food resources. That same individual can go to a food bank. They can go to a United Way. They can go to, a church and say, I don't know how I'm going to feed my family. And then say, here, let us help you, because they are providing it based on that need, often not just on the eligibility. So, that eligibility system makes it tough, so we know that we have people in our system that could benefit from other programs. How do we utilize those other programs? How do we make sure that they even know those other programs together? And that's something that we're really focusing on to better serve those families. Because if we can stabilize the families when they have questions, it's much easier and much better outcomes than if we wait until the crisis occurs. And then we want to ensure that there's continuity of care across the spectrum of ages, stages, and services to help children and youth succeed. We've had focus groups. We've done quite a bit of those. I know Groundwork has as well, and I appreciate you allowing me to come and see those, hear from families and hear their experiences and working with our programs. We want to develop our programs and our services based on lived experiences. And you get a much different perspective when you talk to the clients that are actually impacted by our programs. Just yesterday, we had an all-staff meeting where all 600 employees from the department came together. We had a panel of individuals who talked about their experiences in the system. And the panel started out when the moderator asked some basic questions. How many of you have been on public assistance? And a couple of hands. How many of you have been in public children's service? A couple of hands. How many of you have been had issues within the court system? Hands went up. How many of you have had issues with hunger? Hands went up. How many of you have had issues with transportation? Hands went up. How many of you have had issues with housing? And just on and on and on and on. So these individuals were in multiple programs, often at the same time. But there really wasn't that continuity of care. There wasn't that ability to utilize those resources to help really stabilize things. And we think we can do a whole lot better, by working together. We intend to be very transparent and be accountable. When we talk about new things we're trying to accomplish, we are identifying goals. We're identifying how we think we can get to those goals. We're asking them to invest, and we need to show them how those investments, we anticipate them paying off. We're not going to be afraid to fail, but we want to know why if we fail. And that is something that's going to be really important to us as we move forward in the budget process, as we move forward working with all the different government entities, local government entities, when we deal with advocacy groups and organizations. We want them to know where we're going and lay out that roadmap and how we plan to get there. We want to build on what works. We've got some programs that are working, and we just need more resources. So we've got programs that are working because we've got some really great local collaborations are going on, and we want to identify those best practices. So you really want to focus on finding out what's working. I always use the example of McDonald's. When you pull into a McDonald's, what's the first thing you see on the sign? It says billions served, not thousands food poisoned. You want to make sure that you're looking at what works best. You don't want to have bad outcomes, but sometimes they happen. You want to know what happened and how do you prevent those. But let's really build on what's working and take it from there. Our intent is to focus on people, not programs. And I'll be honest, that's a big lift. That's a challenge. Our systems have not been set up for that. Again, it's not saying that programs aren't doing well. It's just saying that we think they can do better if we really focus on the people and what are all the different things they need and how can we work in a much more comprehensive manner to get to where we want to be. And we're not going to focus just on numbers served, but we want to know numbers served well. And I think that that's something we don't really look at our numbers. We look at, oh, we've served this many people. It's not about numbers of butts in the seat. It's when we are working with people, are we really helping them to change their lives, to better their lives and get kind of outcomes that we all hope to do. So, again, these are just to give us a couple of things. So of our population, nearly 12 million, we know that 2.5 million are children under the age of 18. 670,000 of them are under the age of 5, with 335,000 under 200% of the federal poverty level. And I'll be talking a little bit more about our early care and education programs here in a few minutes, and just want to point out where we have where we're serving children. With children in custody, we know that at any point in time we have 14,500 children are in custody in the state of Ohio. We know that we have about 16,800 plus cases of abuse and neglect that are confirmed, which equates to about 1 every 31 minutes in the state of Ohio. 13.1%, which is a 42% increase since the beginning of the pandemic, of children ages 3 to 17 report having been diagnosed with anxiety or depression. The last data that I saw showed that 1 out of 5 individuals, children that were diagnosed with anxiety and depression, that's diagnosed. So it doesn't mean that we've got the entire population either, but did not receive an hour of care last year. We're not able to get in to get kind of help they needed. So how do we work better to make sure that our resources are there and everything's being coordinated? And one of the big factors that I think a lot of us are experiencing when we talk about caseworker turnover or staff turnover, 29% or fewer caseworkers have at least 1 year experience. So we know that turnover is impacting almost 1 out of every 3. As I said, I want to talk a little bit about childcare, point out some of the differences between 2022 and 2023. Obviously are huge, but what people are paying on average for care. Infant care at $11,400. Toddler care is about $10,400 a year, and preschoolers about $8,580 per year. So again, this is what individuals are paying. The costs continue to go up. We know there's a real challenge, and I'll be really honest with you. I'm old. Stay young for those of you who are. But when I see these costs, I mean, that's a whole lot more than what I was paying for childcare. And I think it's been really eye-opening as we talk to legislators, when we talk with business leaders, and various groups, and talk about what the actual cost is of care and what families are paying for care. I think it really opens their eyes. But if you look at the boxes over on the right from 22 to 23, and 2022, a mom with 2 children in childcare was spending on average the first $9.62 an hour. So that was before the first penny was spent to pay their mortgage or rent, their transportation, their food, any other expenses, anything they had. They were spending that. In just 1 year, in 2023, we were showing that that same family with 2 children was spending the first $10.86 an hour on childcare. So I want to walk through this just real quickly, just as far as workforce decisions that we know are being made, that many of you who are in the childcare space or those of you who are employers may have experienced, but just how does this all play out? And again, when I talk about eligibility-based versus need-based. So this is a hypothetical family, but a typical scenario and types of average jobs that are out there as far as what they're paying. So the Smith family is 4. You got 2 children, a wife who's in school full-time, and Matt, the father, who's working. So if you go to the top, he's offered 40-hour-a-week job at $21.50 an hour. So he needs childcare since the mom's working and or is in school, he's going to be working. At $21.50 an hour at family of 4, he would be $73 over income for publicly funded childcare. His monthly gross income will be $3,698. So if he finds private pay care, so if you go back to the slide before, and I showed $9.62, so we know it's higher than that, but he can find private pay at $9.62 an hour for both kids. His monthly cost for care would be $1,668. His take-home pay, again, before taxes, before transportation, housing, anything else, his take-home pay would be down to $2,030. So he can't afford it. That individual, he looks at all the different things, so he considers an offer for a different job at $21 an hour. So he takes 50 cents an hour less. He becomes eligible for childcare. He would have a copay of $316 a month. By taking 50 cents less an hour, his take-home pay would be $3,296. So taking 50 cents less, utilizing publicly funded childcare, his take-home pay would actually be $1,200 more than what he would have if he were paying for childcare on his own, making 50 cents an hour more. Or could decide to reduce to 30 hours a week instead of 40 at $25 an hour. And again, the numbers are there to show, the types of differences it can make. These are the types of decisions that people are making every single day. It's no different than decisions any of us make. You're trying to decide what's in your best interest. Are you going to take a job or not? How close is it? Do I have to pay for transportation? Is there going to be parking? Is there health care? Childcare is a huge driver and a huge decision that people have to make. And we want to make sure that not only are they making the right decisions, but they're also getting in childcare that is safe, that meets the needs of the families, and also helps prepare those children for learning, helps educate them, and will obviously help them moving forward in life. So this is something that gets talked about quite a bit. That Ohio has the lowest eligibility limit nationally for publicly funded childcare. And I do want to point out, and we'll talk about a little bit more, Governor DeWine came through in our last budget to help make some significant differences that are, I think, paying huge dividends already in Ohio. But in Ohio, our eligibility threshold for publicly funded childcare is at 145% of the federal poverty level, which is $36,000 a year for a family of 3. 27 states have eligibility at 200% or above, and those are all listed there. So we know, as I just showed you the previous slide, there are individuals making that 15, 20, 25 bucks an hour that aren't even eligible to get into our childcare programs. So this is an area that I think obviously gets a lot of talk and a lot of conversation. And there are some things that we have done already. There are some things that the governor had recently done, but there's a lot more work that we want to do in this particular area. So early care and education. There are 3 programs that are out there right now that provide resources. So the one that is most talked about is publicly funded childcare. I just showed you the eligibility thresholds there at 145% of poverty. The governor and the state had identified resources, and we created the Child Care Choice Program, which was designed to provide services for 8,000 child care opportunities for children. That program started in April. We already have over 4,700 children in the program, and 3,200 parents are able to attend school or work as a result of that program. So we do have a child care program now that if they are ineligible for publicly funded childcare, we can immediately seek to determine whether or not they would be eligible for childcare choice and move them into that if that's where they choose to go. So obviously that is something that's really important to us. Now, the other thing, if you look at the top of this chart, there are two things over early childhood education, which is for 3 and 4-year-olds. That's also often referred to as public preschool. There are no qualifying activities, meaning you do not have to be working or in school to be eligible for those services. For both publicly funded childcare and childcare choice, you have to be working and or in school. All right, so early care and education is up to 200% of poverty, and it is available throughout the state. We have aligned the eligibility in the same system so that as individuals come in and they apply for childcare, regardless of their incomes, we would seek to determine which childcare is available to them that best meets their need. So if they would be deemed ineligible for publicly funded childcare because their income exceeds the limit, maybe the childcare choice program would be able to help them. Or maybe they're making less than the eligibility threshold, but they're not working or in school, then we can pursue to see whether or not early childhood education is something that would help them and their families. So we've aligned those programs already and looking where they're at. We're also looking at early childhood education throughout the year, and we're reassessing where we are in the utilization. The first year, we were able to reallocate well over 1,000 slots. We had about 1,700 that were identified that weren't being used. So we're able to reallocate and help families get into that. And one area in particular that we focused on by working with public children's service agencies, we're finding families, foster families and kinship families that were in need of ECE type programs. And we're able to do that by having all these programs function together. Don't want to spend too much time on. There were a lot of changes, step up to quality. I'd be happy to go into it if people have questions. But some major changes. I went from a 5-star program down to a 3-level, a gold, silver, and bronze level. Our goals were to really focus on improving outcomes for children, reducing the administrative burden, and then increase parental access and helping provide more services, make sure providers are receiving better reimbursement rates to be able to make sure that they're in our communities and able to provide the types of resources and services that we're doing. So one of the changes that I will point to under improving child outcomes, it's been very interesting the past year. We've done a lot of focus groups with families, in particular talking about childcare issues. And one of the things that started coming up and has been a regular point of conversation during these focus groups is that post-COVID, one of the areas that families, or the area that families are identifying that they receive the most information about what programs are available, they're saying they get that information from their child care provider, which in hindsight makes perfect sense. But when we started hearing it, we were surprised how prevalent, because we were asking, thinking, okay, how can we best reach you? What do you utilize? How do you find out? Do you do it through TikTok? Do you do it through Facebook? Do you find out, through message boards? Do you find out through mailers? What's the best way of communicating with you? And we were surprised at the answer they came back with. But if you think about, pre-pandemic, a lot of interactions were one-on-one, very transactional. You went to a particular agency, you went to the Department of Health to sign up for services, you went to the Department of Job and Family Services, sign up for services, or wherever it may be. But when the pandemic occurred, we started doing a lot more things by phone, a lot more things online. So you don't have that regular communication. But a child care provider, especially with young children, they are seeing those providers every single day. They've established rapport with them. Once the child starts going to school, you usually don't have those kind of conversations with bus drivers. You don't see the teachers, every day. But child care providers, in addition to the quality education they're providing and the ways that they're helping raise the child, they're also a really important resource in our communities. So we want to make sure that we're providing those resources to them and helping child care providers to know what resources are there and helping families receive the types of supports that they need. We also have put this year through DCY additional access grants. We had tremendous interest, over 6,000 applications that were provided. We were able to provide 421 programs to help increase access for childcare throughout the state. One of the new things is going to be starting the first of the year on new public-private partnerships. There'll be 5 pilots in Cuyahoga, Franklin, Hamilton, Licking, and Montgomery. $6 million has been identified, and we will be working with local childhood nonprofits, businesses, and childcare providers to work together to, as I said, it's public-private partnership. So the state paying a portion of it, the businesses paying 50% of it, will help to identify specific needs that employers may have, working with childcare system to identify childcare availability and work it out. They'll be able to focus on types of services and things that they need. They're going to help them. So it'll help the businesses with employee retention, employee attendance. There also are tax credits that would be available for childcare providers. It'll give them stable demand of number of kids in their system with stable funding and help work with workforce retention. And for the state of Ohio, we think that it's really going to be beneficial, especially getting more children in high quality care and education. So we're really excited about that. We're doing for time here. Real quickly, I'll finish up. So as we are working for our budget submissions, these are the three things you're going to see quite a bit. So I said this is not program driven, it is outcome driven. We are looking at focusing on maternal and infant wellness, early care and education, and children's services kinship. Our goal is to be one of the top performers in the country. We're going to measure ourselves to get there. If we meet our goals of getting to the top 10 in the country for infant wellness, that would be saving 330 babies here in the state of Ohio each year. For early care and education, to get to 60% who are meeting the kindergarten readiness assessment will mean 26,000 more children each year will be entering kindergarten, able to meet the curriculum and be in school ready to learn. And children's services, our goal is to reduce the number of kids going into care by 3,300 kids each year. And that means they'd be living in their home, providing those services in the home before, again, it becomes the crisis, before that child ends up in foster care. And we'll see much better outcomes. So sorry, Brittany, went a couple minutes over, but happy to answer any questions.
No sorries needed. Thank you so much. There was so much to cover, and we just deeply appreciate the goals that the department has set coming into the next General Assembly. We're really supportive and excited about them and think they could be really transformational. I know Danielle Foran had a question. She has her hand up. Danielle, is your question around the, oh, okay. It might be best, we have some data on what other states are doing for preschool we can share. But Danielle, I think you have a question about how many programs are participating in the public-private partnership. Is that the question you wanted to ask?
No, I have just a different question.
Okay.
/ comment. I really appreciate how the state is trying to support families and gaining access to programming. I'm curious if you're aware, though, with the new rules around the ECE grant and PFCC funding, how it is negatively affecting families. So I have a family I ran into at the grocery store. I work in a public school district. I was talking to the family about our program. She was hoping to sign up for next year. Our program is half days, and we have the ECE grant. So she would love to send her child to school Monday through Thursday with us so that she can, meet some of the kids that she's going to be going to kindergarten with. Mom's home, or she has a family member home, so she doesn't want full-time care. She wants to have time with her child at home during those days, but she's in school full-time Friday and Saturday. So she wants to access PFCC those 2 days. But because she can't be on ECE in a high quality program and PFCC in a high quality program, mom's in a pickle now where she's not going to be able to meet the family's needs and educational needs of the child. So I know that there's lots of problem solving going around, and I don't know if situations like that were considered, but we do have a number of families that rule where they can't be in 2 high quality programs is really negatively affecting not only the family, but the child's outcomes. So just wanted to put the bug in your ear. I do appreciate, I know everyone's really working towards making things better for families and improving quality for children, but that is a big thing that's come up in a number of programs across the state. Thank you for the opportunity.
No, thank you. I appreciate you bringing it up. And yeah, obviously there have been a lot of changes that are occurring as we're trying to combine these programs. We want to make sure they are enhancing what's available. To be very frank with you, we also know there's a lot of scrutiny on us, to make sure, that we're that we're doing what we said we were going to do. The legislature wanted to make sure that we were providing additional resources, and we really greatly appreciate they made that investment. And yes, we are constantly assessing and evaluating where we're at, and as programs and as issues come up, Thank you for bringing it to our attention. We've heard that, and you know, we're constantly looking, you know, at ways to better the program. So I don't have any answers as far as that particular case, but we do know that there are consequences for every action. They're the intended and the unintended, and you know, the intent is to provide more opportunity and better opportunities, and you know, anything we can do to fix that, we certainly want to do in a way that meets all of the different program goals and expectations and needs of the family. So thank you.
Thank you for the question, Danielle, and thank you, Joel, so much for the answer. He has obviously put his email up on the screen as well, and we've been just so grateful that the department is so accessible to us and our stakeholders. So if folks have follow-up questions, I know we're hitting close time here, but I think we'll be sharing our slides and the recording afterwards, and Joel has his contact info in those slides as well that we'll get out. So please don't be shy about reaching out. And Joel, we just can't thank you enough for spending part of your morning with us. We know how busy you are, and really, really appreciate the way that you bring the numbers to life with real Ohio family examples, and that's at the heart of what you're doing. So thank you for your work.
All right. Thanks, Brittany. Thanks for everything you're doing at Groundwork.
Have a wonderful morning, everyone. Thank you.